From the News Channel 5 Network, this is OpenLine.
And good evening and welcome into OpenLine. I'm Chuck Long, glad to be with you for the next hour. Of course, OpenLine is your forum and we always invite you to call with your questions and your comments. We've got a great topic that we're going to be covering tonight. We're going to be talking about endodontics and, of course, the care, the treatment of so many areas of your mouth, whether it's a root canal, whether it's saving a tooth, whether it's a chipped tooth, infected tooth pulp. So many different topics that you'll probably want to be calling in on. Our special guest tonight, very excited, Dr. Richard Horwat, great to see you from Bluegrass Endodontics.
Nice.
Good to have you here tonight.
Nice to be here.
So, you know, one of the things I think a lot of people, when they just first start thinking about this, is what would I need to go to the endodontist for? So, kind of, how do you generally answer that?
Different people come to the endodontist for different reasons. You know, they might come because their tooth is giving them pain. Sometimes when you go through a restoration or you have a cavity and the tooth is in pain, you'll come in there. Maybe the cavity went too far towards the pulp. Other times a patient might come in because they have no symptoms whatsoever, but the x-rays show that they have an infection. And oftentimes we want to get the dead nerve out of there. So there's different reasons, a lot of variables of why a patient might come in to the endodontist.
And as always, of course, the number is there for you to call 737-7587. That's 737-7587 or just 737+ if it's easier for you to remember that way. But, you know, a lot of times I think it's maybe the unknown when people think a lot of times I'm going to go in to see the endodontist for the root canal and that sort of thing. There are many different kinds of root canals. I mean, I think a lot of people just think, oh, there's one kind of root canal and that's it, but that's not true, right?
No, they're different. Every tooth is different as well. They're all unique in their own way. Oftentimes you can look at an x-ray and, you know, patients will ask all the time, how long is this going to take?
Yeah.
And it can look really easy and you can be there for a good hour and a half, a couple hours. It might even take multiple appointments. Other times you look at it, it looks like a train wreck. You're in and out of there in a half hour and it's a piece of cake. There's a lot of little variables. You know, we're working inside of the tooth. We don't know what we're getting ourselves into.
Until you get there.
Until you get there. You know, most of them do take about an hour, hour and a half, I think. But there's a lot to factor in. They're all different for sure. Different teeth, front teeth, back teeth. They're all pretty different.
Okay, our line's already busy, so we're going to go ahead and go to the lines here on OpenLine. Jackie is with us this evening. Good evening, Jackie. Do you have a question or a comment for Dr. Horwat?
Yes, I had a root canal done maybe 2 months ago, and what had happened was my jawbone was fractured, and it wasn't able to, my jaw still not able to open and close. Is the doctor supposed to, is the dentist supposed to fix that bill, or am I still required to pay that bill?
The bill for the root canal or the bill for the fractured jaw? Did the actual dentist break your jaw, or?
Yes, sir.
Gee, you know, I'm not exactly sure how to answer that one. You might want to consider getting some type of counsel from a lawyer or something like that and find out what your options are on that. I'm not really sure. And also, too, you know, I don't know how or why he may have broken your jaw. There's too many things about the scenario that I just don't know about. But I definitely would probably consider talking to some type of counsel about that and finding out what your options are. And first thing I would do would be to talk to your general dentist and find out what exactly transpired. It's quite unusual for a dentist to break your jaw. I can't really kind of think of a scenario where that's even possible. So,
well, actually, what he did was I had an ingrown tooth, and that was pushing my other tooth out. And so when he went in to get that wisdom tooth that was close to the other tooth that was pushing, he pulled it out, and I kept having pain in it. So I called him, and he was closed, and then I had to go to another office that he had. And when he said it sounded like I had a dry socket, but when I went, he actually figured out he left some tooth in, and that my jaw was actually
fractured. I get you. You know, there are times when you're going through oral surgery, and, you know, some teeth are impacted, and when a tooth is impacted, there's not really much jaw structure left underneath of the tooth. It is a tricky situation, you know. Hopefully the doctor went over all the risks, alternatives, and benefits prior to rendering the treatment. But, you know, some of the cases are really tough. You know, we're in a difficult position. And, I mean, I'm an endodontist. I do root canals all the day. I have my own concerns that I have to deal with. But when you're dealing with an oral surgeon, oftentimes, you know, it's complicated. It is tricky. Some of them are. And hopefully they went over all those all the risks ahead of time prior to doing that. And normally they can look at an x-ray and they can tell you how risky it might be. I know that I have extracted, I don't know, probably a couple thousand teeth, and it can get tough in there sometimes. So I don't know if the doctor should pay your bill or how it should go. I really just don't have enough information with regard to that specific case.
Okay, well, thank you.
All right, Jackie, thanks for calling in this evening.
Okay, bye.
All right, we're going back to the lines. Jay is on the line with us right now. Good evening, Jay. Do you have a question or a comment this evening?
Yes, I do. Happy holidays to both of you.
And
Thanks.
same to you.
I got a question. I coach Little League Baseball, 8- and 9-year-olds, and we've had a recent injury to a child. He got hit in the mouth with a baseball, and I've always heard I put pressure back on it and kept the tooth, pushed it back in. I was wondering if that was okay. And also, I make my team wear mouthpieces now, and I just wondered what your thoughts were on that. Thanks.
Mouthpiece is a no-brainer, especially if it's a child. I definitely would get one, especially in the infield. They should probably, Little League especially, they almost should make it mandatory, I think. With regard to putting a tooth back into its socket, I'm guessing that the tooth came out and you put it back in. I'm not really sure. That's actually the best thing you can do. I've read different pieces of literature of what your options are on that. Most of what's best for you is something called Dakin's solution. I don't think it's practical to have that in your back pocket. Your best option is probably to put the tooth back into the socket. Even if it's dirty, I was told not to rinse it off or anything like that, because there's a lot of things on that particular root structure, like growth factors, that will help things kind of heal. You can anticipate the root dying. I would definitely send the child to a general dentist or an endodontist. He will likely need a root canal on that tooth. There's also things that can happen, such as the root fusing to the bone. There's a lot of little things going on in there, but as far as what to do when the tooth comes out, your best option is to put the tooth back in there as soon as you can. Get the child to emergency care as soon as you can. If you're home and you don't do that, I know another thing to put in would be milk. Something about the protein in milk protects the growth factors and the things like that are on the tooth. What you don't want to do is you don't want to run it underwater. You don't want to wipe the tooth off, because there's a lot of viable cells there that are very, very important in healing, and you don't want to do that.
All right, good to know. So thank you so much for calling in this evening, Jay. You know, a lot of times, too, when you're thinking about these different situations, I think the unknown is what people, are often coping with. When we're talking about the top reasons that people visit the endodontist, what would you say those would be?
Number one reason is to get a root canal. I mean, we specialize in root canals. That's what they come in for. Oftentimes either a general dentist, again, will see that there might be a lot of cavity in the tooth. The tooth might be symptomatic. The patient might be in pain. When the nerve is if the nerve is alive, and the nerve might get infected or inflamed. If it's causing discomfort, sometimes you only have two options. That's to take that nerve out or to actually extract the tooth. But sometimes the patient doesn't have any symptoms at all, and maybe the x-ray might show some type of abscess, like I had mentioned, and that might be why they need one. But the main reason why they come in is to get a root canal to an endodontist, or to have either a root canal redone. And there's other things like apical surgeries, and there's complicated procedures as well, but the main reason is for root canal.
Well, and I know probably a lot of our viewers are like me. The first time that I had a root canal, I had just heard so many stories about what a root canal was about. So I went in, my root canal was actually very simple. It was not painful at all. But you did say that there are many different degrees of root canals.
Yeah, they're all different. I joked around earlier when we were talking, and I had mentioned, I've had a patient come to me, and they said, my God, that's the best experience I've ever had. I didn't feel anything. My God, I thought this was going to be painful, and I just shake their hand and thank them for everything. But they come back a year and a half later, they might need a root canal on a different tooth, and they say, my God, that was the worst experience I've ever had. There's different variables to factor in, when the nerve is inflamed, whether the tooth is dead and things like that. Sometimes with inflammation, giving them anesthesia or getting them numb might even be a little bit more painful than you want it to be. But there's so many variables to factor in. All root canals are different. For the most part, though, I think we can make just the majority of them painless. We do take our time. I know we take our time in our practice. We have a lot of pride in what we're doing. We don't want our patients to feel anything when they come in there. We take our time, and we're very empathetic to what they came in for. But most of the time, especially if they're not in any discomfort before they come in, I can usually take care of the situation and have them feel pretty much nothing the entire procedure.
Okay, well, that is good to know.
It's come a long way.
It really has, definitely has. So we are talking about your teeth, and I know you have a lot of questions. We are going to take a break right now. When we come back, Ask the Endodontist is going to continue here on Open Line. If you're thinking about pain in your teeth, you're thinking about sensitivity in your teeth, that kind of thing, give us a call. 737-7587 is the number to call. We'll take a short break, and then we'll be right back after this.